Module 5, Joint Attention. Learning objectives. Understand the importance of joint attention and why children with ASD may have difficulties with initiating joint attention. Become aware of ways to encourage joint attention in children with ASD. Joint attention is one of the neuropsychological skills represented in executive functions. Executive function is an umbrella term for several actions that require the use of frontal lobe of the brain. Guiding actions including planning, working memory, initiation, and impulse control. Difficulties in executive functions are frequently seen in children with ASD and can often affect communication and social skills. Joint attention is developed typically between 6 to 12 months of age and involves the sharing of attention or non-verbal communication between the child and another person about an object or event, for example, toys, books, or facial expressions to share enjoyment. The initiation of joint attention in typically developing children is often referred to as a developmental milestone for early social development and the beginning of language acquisition. For children with ASD, many of the joint attention behaviors, including eye contact and pointing for intentional communication, are either delayed or absent, affecting social development and communication. When initiating joint attention strategies, be sure to use developmentally appropriate and motivating toys and sit in front of the child. Choose to play with a toy the child selects or is looking at. When the child meaningfully plays with the toy, immediately perform the same act within the child's focus. Prompt for play acts by moving toys closer to the child and use verbal prompts. Create a sequence of play events that are predictable, repeatable, and developmentally appropriate, like cause and effect toys. Ask the child for help during play and wait for communication. Talk about the toys, items the child may see, and the child's actions. Remain at the child's eye level and bring objects up to the child's eye level in a natural manner. Weiland and Schreibman 2003 have a joint attention program for response and initiation based on discrete trial training and pivotal response training. To focus on initiation, there are several levels, starting with the child's response to their hands on an object. While the child is playing with one toy, place the child's hand on a different toy. If the child engages with the newly presented toy, either manipulates with it or looks at it for at least 5 seconds, move up to level 2. Response to being tapped. While the child is playing with one toy, present a new toy to the child and tap it with their hand. Move to level 3 if the child engages with the new toy. Response to being shown an object. While the child is engaged with another toy, show a new toy to the child at eye level. If the child engages for 5 seconds, move on to level 4. Eye contact. Look at the child while holding the toy. Eye contact is required to be given to you or the toy. When eye contact is mastered for 5 seconds, move on to level 5. Following a point. While the child is engaged with an object, establish eye contact with the child. Then, turn your head and point to another object in the room. The aim is for the child to turn their head in the same direction. Key points for joint attention. Joint attention is an executive function shown to be delayed or absent in children with ASD. Joint attention is the sharing of attention or non-verbal communication between the child and another person about an object or event. Without joint attention, children with ASD will have difficulties with social development and communication. There are several ways to initiate joint attention with a child. Joint attention will not be learnt by the child instantaneously and will take time. That's joint attention. Thank you.